Welcome back. You're watching McLaren Port Huron's Today's Health, and I'm talking with orthopedic surgeon Dr. Leonard Karadimas. We're talking about the hip. All right, how do you make a diagnosis?
Well, just like anything else, there's going to be the physical evaluation. So you examine the patient, check range of motion, certain signs, and tests and so forth. X-rays, of course, show us the bones, and for hips, if we're talking about hips, in which we are in arthritis, you can really see that pretty well on X-ray. And sometimes, like we talked about, there are other issues you can have, like bone spurs. Again, you should be able to see those on X-rays. But if you have a soft tissue problem, like a cartilage or labral problem, that would have to be, you'd have to get an MRI to see something like that. So if you have a hip problem and it doesn't look like there's a lot of arthritis, and it feels like it might be a torn cartilage or something, you'd get an MRI.
So what are your treatment options then?
Treatment options are fairly limited when we talk about the hip, because injections typically don't work well. It's not that we never do them, but they're pretty rare to do an injection, and it would be of steroid, of modern day cortisone. There is no FDA approved like lubricating shot for hip problems. You can take oral anti-inflammatories, like again ibuprofen or Relieve. You can again modify your activities. Years ago, when I was in training, we used to tell people to use a cane. That's not too popular anymore. People are not willing to do that. And you can do physical therapy, and that's about it.
And how long do you usually, or do people usually take to go through these different treatment options, or are they like, yeah, I did that for a month, so what can you do to fix it?
So the most common thing to see with a hip problem, usually it's arthritis, is folks will come in, find out what they have, and then maybe try an anti-inflammatory for a while, maybe a little bit of therapy, but it doesn't take too long to get to the next step, I think, because by the time they come see me, they're pretty bad usually, and those things typically don't work very well.
And hip really limits people's activity, right? So you can say, well, stop doing what you're doing, but then that gets to be just about anything.
It's very difficult. Anytime you're talking about a weight-bearing joint, knee, hip, what are you going to tell somebody? Don't get in and out of your car, or avoid going to, Myers and shopping. It's a very complicated thing for people.
Well, we're going to take a break and go on location to McLaren Physical Therapy with our reporter, Sarah Tate, and then we're going to come back and talk about surgical treatment options.
Perfect.